Good morning from the medical team at Nipawin Medical Clinic. This is my NP student. I say my lightly. She's amazing and she's going to make a wonderful NP in the next 3 years. Nicole is her name and I'm Tara Rudy. Shift Your Life Design is all things new, and today I wanted to bring our conversation to the medical side of my profession. And we thought a good topic of discussion today would be how to be new at the medical system. So Nicole, what are some things you think would be valuable information to share with the world about becoming a patient of one of ours?
So I think one of the important things is that you have a right to be an active participant in your healthcare. So asking questions, asking, what kind of medication you are, why we're prescribing it, just being active in those visits rather than just, staying quiet and not asking those questions.
Right, so keeping a running tally of maybe some of the questions that you want to have answered, but make it a two-way conversation. Our job is to provide you insight. Your job is to make the final decision. So as an active patient, there is some good things that we want to ensure that you know, and that is having the right to a provider you're comfortable with. Is there anything that you'd like to share in that regard?
So you have I think, if you're not happy with the provider you do have the right to move on to maybe a different provider. Sometimes it's just not a good fit with everybody. Also too, that you have the right to refuse treatments that are offered to you by a specific provider. So you can get the information and then you have the right to consent or not consent. You don't have to go through with whatever, for example, if we say recommend something, you don't have to go through with it.
And that medicine is a accumulation of several tools in a toolbox, and there's traditional medicine, and that is what we practice and we study. There is also natural medicine, and the right is for you to have your answers or your questions answered appropriately. We are not experts on that sort of side, but it is absolutely up to you to decide what therapy. I believe health is a accumulation of all tools in the toolbox, especially when we're in a medical difficult situation. So as a good patient, what could you do to be a good patient for us as physicians and nurse practitioners? It starts with having an active insight into your medical history. Many patients will come to our door with the expectation we have a good history on our chart. I want to assure you that in modern day, we've moved to computers, and for many patients, if they don't frequent visit, their health profile is very lacking in that information from your past. And I believe it's a tool we should all have and grow. A health record for ourselves. You never know what life will bring, and perhaps you might have to move to a new community, and having that record with you is a good option for you to take alongside. In that regard, what about medications? What's a good tip for these individuals?
So I think bringing a list of your medication is really important. Having that list allows us to update that information, adjust medications. So writing down every time a new medication is prescribed by various doctors and bringing that list in, or even bringing in, your bubble packs or your vials of the medication, so we can make sure that your file is updated with us, and just being accurate in that regard.
Something I notice in my practice is off-label use of medications. People don't understand that there's several uses for various medications, and having the indication is essential. I could look at your medication and assume you have depression, but in fact you were prescribed this medication for restless leg syndrome. I just need to give you a little tip on that, because it's often the inside that people don't always know why people are prescribed certain meds, so that is your responsibility. So act responsibly with your own personal interests in mind. Keep in mind we're human and we all have a very different approach to medicine, and with that we have a very different background, passion for medicine. Each of us come with different learning experiences. Each of us attend to different clinical conditions. My practice is a lot of mental health. For Nicole, she might be more into cardiovascular wellness. She's just learning her ropes and hasn't quite figured out what she adores in medicine yet, but I think that will come in time. So just keeping that in mind, not all professionals, we are family medicine orientated, so we are trained to treat many of the same medical conditions, but many of us come with a special interest and we learn a little bit more in certain areas. So you can do your own research, and if you feel like your family doctor isn't the one suited for you, then that is your responsibility to understand that and make a shift. So the other thing is I just want to make a tip quickly that if you're suffering with a disease such as high blood pressure, bring those values in. Write them down. Be kind of congruent in making yourself a diary and keeping track of your medical history and what your trend is. That can better give us a direction on which treatment management we will go with. So remember, you are the most important part of the health relationship. Without your insight, we could not lead the way. It is your health, and your final decision gets to be what goes. So I need to encourage you to be get yourself educated. If you get diagnosed with something, educate yourself. It's important. Google is at our fingertips, and many of us encourage not to Google. But it is also there for you as a positive experience to learn about what you can do aside from medicine to better manage your health. So thanks for listening, and we look forward to all things new in many different ways.
Bye.